My name is Steven Lederman. I'm a non-invasive cardiologist. I've been in practice for 36 years. I practice in Moorestown, New Jersey. I opted against doing invasive cardiology, interventional cardiology, because my passion was taking care of people and doing echoes and nuclear studies, that kind of aspect of cardiology. The diet is a conversation that I have probably with every visit. Certainly with new patients, it's a key part. And it's interesting that I would say 90% of people choose to not follow it, about 10% do. And I'm consistently amazed at how well the 10% do who are successful. And it baffles me that the other 90% just don't get it. The way I approach nutrition is that I make it part of every visit. It's very hard these days because the amount of time that we have to spend with each patient is pretty limited, and that's why I'm always about an hour late by the end of the day. But I think it's really, really important to do that, and that's why I really insist on having that conversation with my patients. It's something that I've become very passionate about, especially when it's reinforced by how well the people who follow the diet do. So the thing that I have found over the years that has made it easier for me to incorporate whole foods, plant-based nutrition into my practice is that I have the conversation with the patients. I give them a resource list, which of course has your name and your website and your books. And there's also a dietitian that I use privately, not part of our hospital system, who is really knowledgeable about whole foods, plant-based nutrition, and has been really helpful in helping people transition. And interestingly, our hospital system is about to start a whole foods, plant-based nutrition program. I'm in a group of 10 other cardiologists, and it's interesting that a few of the doctors are somewhat interested, but I would say most of the rest of the group, I wouldn't say looks at me like I'm from Mars, but they just, for lack of a better term, just don't get it. And it's not a source of contention. They have their ways of practicing medicine, and I have my ways. And but it's just interesting. The thing that I think will force everybody's hand in terms of making this the cornerstone of everybody's practice is accountable care, where you get paid on how well your patients do, not on how many tests you order.